Hi, I'm Dr. Jing Liang. Today we'll be talking about how thyroid health is related to chronic pain and inflammation. Just a brief introduction about myself. I'm a pain management physician, and I specialize in physical medicine and rehabilitation, as well as interventional pain management for the past 15 years. A couple years back, I started seeing more patients coming back in needing more injections and all different type of medications to control their pain. I realized that it was important to start looking at pain through different lenses. We have to ask what is actually driving the inflammation process in these patients. That includes in nutrition, lifestyle, body mechanics. Is their nervous system regulated? And also looking at any kind of internal imbalance in their body. I would start asking questions like, do they have hormone imbalances? What kind of gut issues do they have? And is there a sign of chronic toxin exposure? And what this led me was that I opened up on my own clinic eventually, which focuses on the root causes why people are having chronic pain and inflammation. So today we'll be talking about specifically about how thyroid health is related to all these symptoms. Before we start, a quick disclaimer. This webinar is for educational purposes only. It does not replace any medical care with your physician. And please do not start any medications or supplements without discussing this with your healthcare provider. So we begin. I want to start on this topic on the bigger picture concept. A lot of the chronic pain is treated locally, and we focus on where it hurts, whether it's at the neck, the back, shoulder, or knee. And sometimes that's a really good way to start because usually it starts with a structural issue. But when people start to have persistent pain, despite all different type of treatments, and they continue to have stiffness and feeling inflamed, and especially after exercising, because they have poor recovery, that's usually a sign that something is driving the inflammation systemically. And it's not just something that is locally. The thyroid affects many things, specifically metabolism, which is how energy is being produced in the body in the cellular level. When the metabolism slows down, tissues don't heal or recover as efficiently as it should. When the thyroid function is suboptimal, it will affect your tissue repair, how your connective tissue recover after exercise, how well your muscles, tendons, and ligaments function. A lot of times we may also overlook what's really important, which is the nervous system. When the body is in chronic fight or flight state or feeling dysregulated, it will affect the thyroid function. At the same time, the thyroid function also influences how the nervous system is sensing pain. Because if your nervous system is overwhelmed, your perception of pain would be amplified. When we look at the surface on where the pain is, what we want to keep in mind is that there's a much deeper level underneath that when someone has persistent pain, inflammation, and poor recovery, along with nervous system regulation. So where we have pain is really the tip of the iceberg. What's really underneath is where we should look at to have more sustained relief and better outcome. And that's today's talk and where the framework is based on. Not every person who has pain has a thyroid issue, but thyroid health is one of the most important piece of the bigger picture that deserves attention. Most people think that thyroid, it's just a gland that affects weight and energy, but it actually is the metabolic control center of the body. It regulates how cells are being produced and use the energy in a cellular level. So the energy currency of our body is made of ATPs. And it is being made at these little organelles in every single one of our cells called the mitochondria. The mitochondria, in a very complex way, makes these energy from the food we eat, um, the vitamins and the minerals and the nutrients. And if this energy production slows down, your tissues will not function very well. And this could be all different type of tissues. The thyroid also affects how oxygen is being utilized. If cells cannot use oxygen optimally, it's going to contribute to fatigue, low endurance, and feeling of heaviness and achiness in your muscles. And the thyroid also influences how protein are being made, as well as we talked about tissue repair, because you will need protein to repair your tissues. People with suboptimal thyroid function, they will have signs of slow healing, more stiffness, muscle tension, feeling like their body is not bouncing back the way it used to be. There are thyroid hormone receptors all throughout all the cells of our body, which means that thyroid hormone is essential in every single cell and in all the functions in our body. So when the thyroid secretes these hormones, something happens to it. It gets converted to a more active form. And these active forms is the one that binds on all the cells in our body and stimulates our cells to work. For example, if in the brain, if there's not enough thyroid hormone activity, people will start feeling brain fog, slow processing, difficulty in concentration, even mood changes. And in the immune system, and if the thyroid is suboptimal, what you would start seeing is the onset of autoimmune disease, or the worsening of autoimmune disease. And of course, the thyroid itself can have its own autoimmune disease called something like Hashimoto thyroiditis. So when something is not functioning properly in the thyroid, it affects every single organ and in the body. People with suboptimal thyroid function don't always feel sick dramatically, but they would feel like their body has been operating in a low gear for a very long time. Let's talk about a little bit about how thyroid affects energy, and specifically in these little organelles called the mitochondria. Briefly, in the last slide, I talked about the thyroid secretes hormones. Now, these hormones float around the body and it actually gets converted to a more active, more useful form. And that form is called T3. And that is the form of the hormone that drives our cells to produce energy in these little organelles called mitochondria, which produces the ATP, the energy currency of our body. So when the thyroid signal slows down, all the energy production slows down as well. We talked about the brain function and the immune function, how it's being affected by low mitochondrial output. So I would use this in the analogy of a phone battery. If your phone is running at 15%, technically it still works, but things seems to be slower, less efficient, and more sensitive to stress or overheating, like a computer. As you know that if your laptop overheats, it actually would slow down. Our body functions the same way. If the thyroid hormone levels are lower than what it should be, your energy production decreases, and that contributes to the symptoms people are experiencing. On the other side of the equation, if the mitochondria themselves, if they're not functioning because you're not getting the right nutrients, you are having a nervous system dysregulation, you will start having all these lactic acid buildup, like you're working out way too much. And normally when we have these lactic acid buildup, we would have naturally produce antioxidants to neutralize these. Now, if you're looking at the mitochondria itself, there are many things that the mitochondria needs to work at its best. Nutrients, minerals, and vitamins, it's all going to be essential for the mitochondria to be efficient. So let's say if the mitochondria don't work as efficiently, that will also affect the output of the thyroid hormone because there are mitochondria energy factories inside the thyroid cells. When any mitochondria that's not working efficiently, in my other lecture, we talked about you start having some sort of lactic acid or byproduct buildup. And those is stressful for your body. So our body actually makes these antioxidants to neutralize it. But sometimes you have so much lactic acid buildup as if you're working hard for a really long time that the body's having problem to keep up with producing the antioxidant to neutralize them. And that usually occurs when people are in a chronic stressful state. They've been sick for a long time, or they have continuous chronic toxin exposure. So the thyroid function is not always the only cause, but when you have suboptimal thyroid function and your mitochondria is not working very well, along with ongoing things that's driving your inflammation, that's when your body's starting to crash. So aside from affecting the mitochondria, the thyroid also does not work by itself in a hormonal um, um, interconnection with the other hormone organs. It is part of a larger communication network that's called the HPA axis, which stands for hypothalamic pituitary adrenal axis. And this axis involves the brain, the adrenal gland, and the thyroid. They're all interconnecting together. When the body's under stress, whether is it emotional stress, poor sleep, chronic infection, blood sugar swings, or physical stress, your cortisol regulation or your cortisol rhythm would be dysregulated. And cortisol can affect thyroid in many different ways. And in my past lecture, we talked about how important optimizing the rhythm of the cortisol would be for your everyday function. First thing cortisol can do is that it could actually reduce the conversion of your thyroid hormone to the more effective form, which is T3. This conversion has to happen in the tissues for the thyroid hormone to work optimally. It could also affect how sensitive the cells are sensing these thyroid hormones. Remember, every single cell has receptors on their surface. So when it gets a little signal from the thyroid, that's when the cells starts working, stimulating the mitochondria. So if your other hormones like cortisol, it's not at its best, the cells sensing the thyroid hormone is not going to work that well, even though you have enough hormones being secreted. So that's why people can actually have symptoms when they have normal thyroid labs, because maybe their receptors are just not as sensitive. There are a couple of patterns of stress level people can feel. And usually when the cortisol is elevated, people will feel that wired and anxious, and they can have problems sleeping. Now, when the cortisol patterns become depleted, because that does happen, because if your cortisol rises, but it gets to a point where it can't keep up anymore, you're just not producing enough cortisol, they will start feeling really burned out, fatigued, and really foggy in their mind. And a lot of us we can experience both patterns at the same time. It doesn't have to be one or the other. So the important takeaway is that the thyroid function is not just a thyroid problem. You have to look at how it's connected to the brain, the adrenal system, which sits on top of your kidneys, your nervous system. How are you responding to stress? And is there any ongoing inflammation? And how also your sleep and nutrition. That's why we try to assess the patient more holistically instead of just looking at lab values or sometimes one lab value, which we'll talk about in a bit. So some people develop chronic inflammation and chronic illness, and that in turn will affect the thyroid function. And the thyroid function can also worsening inflammation. So it's like this feedback loop. Bad thyroid suboptimal makes more inflammation. More inflammation affects how the thyroid functions. So it's like this feedback loop that you kind of stuck in there. So for example, after surgery or an injury, recovery can be slower and more difficult because you have an inflammation from the surgery, and now it's affecting your thyroid. Now your thyroid is low. It's going to affect the way that you've been recovering from the surgery or the injury. And also when someone has ongoing inflammation and inflammatory exposure or toxin exposure, it affects how the cells and the receptors are responding to actually adequate thyroid. So over time, this cycle, what we're looking at is we're trying to break this cycle. So the goal is really not just to replace the thyroid hormone alone. Hormonal therapy definitely has its place at appropriate time but think about it as we want to use this hormonal replacement for this example. If it's a thyroid replacement for hypothyroid, we also want to ask the question, why is the body stuck in this chronic inflammatory state in the first place? So we look at all these other factors that could ultimately help the body in the long run and not just replacing the thyroid hormone. So over the last 15 years, I've seen a lot of patients have a lot of pain despite multiple different type of treatments, like physical therapy, injections in multiple areas, different type of medications, and some of them even had surgery. But in a lot of these patients, these pains just don't improve long term. So when the body is really stuck in this persistent state, despite multiple different interventions, we need to ask different type of questions. These questions would be, why is the body producing energy as efficiently in a cellular level? So we talked about these energy currency like ATP and how well their mitochondria is functioning. Do they have a hormonal balance? Is their cortisol rhythm out of sync? Is their thyroid truly optimized, or they are in a suboptimal state? And if their thyroid is suboptimized, how is their sex hormone being balanced? And ultimately, think about this way: healing requires energy. You need energy, a very functional, efficient mitochondria to help your body repair, regulate the inflammation. Regulate the inflammation. Um, um, Sorry, something just popped up. I just have to fix that. So part of the comprehensive approach is really looking at what is interfering with this body's ability to heal in the first place, because the body is amazing. You just have to give it the support it needs to do its job. So we need to look deeper than instead of looking at just chasing the symptoms alone. We want to look at patterns. So some of the common thyroid patterns we see in people with chronic pain is it's definitely the thyroid function not working well. So you can have low thyroid, we call it hypothyroid, and the tendencies would be having muscle stiffness, joint pain, and fatigue. But sometimes you want to look at the pattern. If somebody just have one thing and not the others, it might just be a symptom, like I said, just as maybe a structural thing, maybe having some tendonitis or overuse symptoms. Another pattern is a subclinical dysfunction of the thyroid. So your lab work, and many times we just get a TSH, that could be normal, but these people are still having symptoms of thyroid function. So we talked about why, right? So first of all, maybe you're producing enough hormones, but the receptors are not working correctly. Maybe there's under driving inflammation, we're not being addressed. And also, lastly, the truth is that there are other labs that we usually don't look at when we just get a TSH. And the range in lab work, usually it's not a range that is for optimal range. It's just trying to tell you, is there something going wrong? And then you really need to address it right away. So all of that could contribute why you're having symptoms, but have normal TSH. And we could also have autoimmune disease that's affecting the thyroid. So people who have autoimmune disease in the thyroid, like Hashimoto's, their symptoms can fluctuate. They can go high thyroid or low thyroid because usually it's driven by an ongoing inflammation response. You want to look at the pattern, not individual symptoms, right? Symptoms give clues, but when you have multiple symptoms coming together, it forms a pattern and gives us a bigger picture on what's driving underneath. Remember the iceberg, the tip of the iceberg versus what's underneath the surface of the water. So a chronic accumulative trauma or stress will really affect the thyroid. And how does it do that? We can actually talk all the way back to early life. So when you starting having early life stress situations, and you can have multiple of them, it could be minor, small stressors, it will affect that HPA axis. Remember the hypothalamic pituitary axis, in which it drives on the cortisol rhythm. So when we have an alteration in the cortisol patterns, it will would have downstream effect. So first, the stress will affect our how our cortisol rhythm is going, and then in turn, it's going to affect how our thyroid are being affected. And now, when our thyroid is being affected, now you're going to have symptoms. And it's not only affecting the thyroid, you also have to think about all of this HPA axis problem can affect your gut, your immune system, and the way how your chronic inflammation is showing up. And that's why we have to look at this root cause approach. The goal is not just to chase out lab values. We have to have deeper questions. Why is the thyroid becoming dysfunction in the first place? So we have to identify different drivers. These drivers would be chronic stress, whether it's emotional, physical, medical. It's all going to affect the HPA axis. Gut health is also a major factor that becomes a large portion of the immune system and connected to the gut. 70% of the immune system actually lives in the gut. We have to look at, does somebody have nutrient deficiencies? And it's just very common in the way that agriculture is being produced nowadays. So nutrients like zinc, selenium, iron, iodine, vitamin D, they all play very important roles in energy production and thyroid function. We have to look at if there's a possibility of toxin exposure, a history of mold exposure, heavy metals, occupational hazards, and possible environmental chemical exposures. All of these things contribute to ongoing inflammation and stress in the body. So if you look at the tree diagram, as we discussed, the symptoms are on the top here at the leaves, right? You have fatigue, inflammation, gut health, gut issues. But on the bottom, this is where all the drivers are, where the root causes. So you want to be looking at the bottom in the long run, so your results, your outcomes are better and it's more sustainable. So we want to look at a system-based approach, not just on symptoms. So the takeaway is today, thyroid health is closely connected to your energy production, inflammation, recovery, and pain. Normal labs does not mean optimal function. We always want to ask whether why the body is producing energy. We always want to ask whether the body is producing energy efficiently and what may be interfering with that process. And we want to reduce the chronic stress and calm inflammation, because that creates the biggest improvement in your overall health and improvement. The goal is to treat the symptom, not to chase. The goal is to treat the system and not to chase the symptoms. When we address the root causes, that's when people often will feel significantly better. Well, thanks for joining me. And I hope this discussion helped you understand better and have a more comprehensive approach to pain, inflammation, and thyroid health. If you're interested to learning more about this model of care, or you like to, whether just to talk about if this approach would be appropriate for you or somebody you know, please feel free to scan the QR code and for a discovery visit. I wish you a wonderful day and week.